Public health is the foundation of any strong society, ensuring that people have access to health care, vaccines, clean water, and disease prevention services. In Palestine, especially in Gaza, the public health system has always faced challenges, but the war that began on October 7 has pushed it to the edge of collapse. Hospitals have been destroyed, medical supplies are running out, doctors are working in impossible conditions, treating thousands of injured people while trying to prevent a new health crisis from emerging. Among the most serious threats is the risk of disease outbreaks, including polio, as vaccination have been disrupted and sanitation conditions worsen. But despite the devastation, Gaza's healthcare workers continue to fight for their people. They operate in pumped-out hospitals, perform surgeries without anesthesia, and vaccinated children in war zones. In fact, their resilience and dedication show that even in the darkest time, the commitment to public health does not waver. So, this presentation will explore the state of public health system in Palestine, the challenges it faces, and the urgent need for support and solutions. While the war has been created an overwhelming crisis, it has also shown the incredible strength of those working to protect public health. Because in public health, every life matters and every effort counts. Here is an expanded version of what we will say during our presentation, based on the slide content we will have. So we will keep the slide text conscious for clarity while providing more context and details that we explain verbally. But before we will begin, let me introduce the students who will be presenting today. I am An Ayman Al-Hor, and I will be present the introduction, identifying the public health problem and defining the problem. Sujud Abdulhal will present population affected and importance of the issue. Rawan Khalifa will present magnitude of the problem. Rawan Mansour will present solutions to tackle the problem. Dima Mansour will present recommendations and conclusion. And finally, Nagam Duher will present the impact of the problem. So let's begin our presentation for today. Firstly, identifying the public health problem. What is the public health crisis in Palestine? The public health crisis in Palestine, especially in Gaza, is multifaceted. The health system has been under extreme pressure due to the ongoing conflict. Hospitals have been damaged or destroyed, creating sufficient gaps in essential healthcare services. Basic medical supplies are running out, and many health facilities are unable to function at full capacity. Additionally, the risk of disease outbreaks, including polio, is rising. So, overcrowded shelters and a lack of clean water are major contributors to these public health problems. So, the public health crisis in Palestine, healthcare system under extreme pressure, the medical supply shortages and hospital destruction, the high risk of disease outbreaks like polio, malnutrition, infections. Finally, overcrowding in shelters increases health risks. So let's continue with defining the issue. The breakdown of healthcare services. A public health issue is one that affects an entire population, not just individuals. In Palestine, the healthcare crisis presents multiple challenges, including limited access to primary care, vaccinations, and maternal health services. The burden of chronic disease such as diabetes, heart disease, and cancer is increasing, yet access to proper treatment remains limited. Malnutrition due to economic hardships affects children's growth and weakens immune systems, making them more vulnerable to diseases. Additionally, the mental health crisis is growing as a prolonged exposure to conflict and displacement has led to high levels of stress and anxiety and post-traumatic stress disorder (PTSD) among both children and adults. But despite these challenges, Palestinian doctors and nurses continue to work tirelessly to save lives, often with minimal resources. So, the breakdown of healthcare services are disruption in medical services and vaccination programs, lack of clean water and sanitation, which will rising disease risk, severe shortages of doctors, nurses, and medical supplies.
Population affected. Who is most impacted? Children, pregnant women, chronic illnesses patients, and healthcare workers. The population most affected by this crisis includes children who are at high risk of polio, malnutrition, and other preventable diseases. Pregnant women are also facing significant challenges as there is a lack of maternal care, which is crucial for their health and the health of their babies. Those suffering from chronic illnesses like diabetes or cancer are unable to get regular medications or treatments due to the lack of available supplies and functioning healthcare facilities. The situation is also difficult for healthcare workers who are working under extreme stress, facing personal danger, and having to care for a large number of patients with limited resources. So, what is the importance of addressing the issue? Why is this crisis important? The importance of addressing this issue cannot be overstated. Without access to adequate health care, preventable deaths are occurring every day. Diseases like polio, which were once controlled, are now resurging due to the interruption in vaccination programs. The public health emergency in Palestine does not only affect the immediate health of individuals, but it also impacts the region's stability. If the health crisis is not addressed, it could lead to even more severe outbreaks, not just in Palestine, but in neighboring countries as well. Furthermore, this crisis has devastating long-term effects on the population's mental health, and we need to take this into account when planning solutions.
And now let's talk about the magnitude of the problem. The scale of the problem is massive. Over 70% of the healthcare infrastructure in Gaza has been either damaged or destroyed during the conflict. This includes hospitals, clinics, and other health facilities. The situation has worsened as medical supplies have been cut off and staff is insufficient. As a result, the healthcare system is operating under extreme pressure, unable to meet the needs of the population. Disease outbreaks are spreading quickly, with polio, cholera, and respiratory infections being the most immediate threats.
Now I'm going to share with you some of these perspective. Medical perspective. From a medical standpoint, Palestine struggles with unqualified healthcare infrastructure and shortage of medical professionals and restricted access to essential medication and equipment. Hospitals often operate under severe limitation, especially here in Gaza Strip, particularly during times of war. Infectious disease, malnutrition, and chronic conditions like diabetes and heart diseases are also prevalent due to poor living conditions and limited healthcare access. Number two, economic perspective. The health crisis in Palestine directly affects its economy. Frequent medical emergencies strain government budgets and international aid efforts. Additionally, a sick population reduces workforce productivity, hindering economic growth, so many families going to fall into poverty. And number three, here we have psychological and social perspective. If from psychological and social perspective, the continuous exposure to violence, displacement, and uncertainty leads.
Now, let's discuss solutions. One of the first priorities should be the delivery of emergency medical aid. Mobile clinics can be deployed to provide healthcare in hard to reach areas. Rebuilding hospitals and clinics should be a priority, ensuring that they are well equipped to handle future crises. Restarting vaccination programs, particularly for polio, is essential to prevent disease outbreaks. Access for healthcare workers must be ensured with their safety priorities so they can continue to provide care during these difficult times. Finally, efforts to ensure clean water and sanitation in shelters should be prioritized.
Recommendations. There are several recommendations to improve the situation. First, increase international medical support to provide necessary supplies and resources. Secondly, long-term investments are crucial in developing permanent healthcare infrastructure to withstand future crises. Thirdly, strengthen disease surveillance system to monitor outbreaks like polio, cholera, and respiratory infection. Support healthcare workers with advanced training and psychological support to help them cope with the pressures of their work. Promote community awareness through vaccination campaigns and education on hygiene. Finally, establish mental health recovery programs to help survivors of the conflict cope with trauma and stress. Conclusion. In conclusion, while the situation is dire, silence and hope are at the core of Palestinians' healthcare system. Despite the enormous challenges, healthcare workers continue to work tirelessly to save lives, even under the most difficult circumstances. The future of healthcare in Palestine depends on immediate intervention and long-term support. If we take swift action, we can not only mitigate the current health crisis, but also build a more resilient and sustainable healthcare system for the future.